invest in your mental health and do it when things are going well. And a lot of times we tend to wait until the crisis to actually practice emotional intelligence. But to be able to admit that you are struggling and to be able to ask for help or tell someone to help you find help, that is the greatest indicator that you do have and you are exercising emotional intelligence. We are a people development company. All things that relate to people development internally and externally, and helping them to be able to put the best image forward and to use that image, be able to create the quality of life that you want. So Image Wealth System for Success is a system that anyone can learn and use, and it is based in and rooted in emotional intelligence principles.
Please welcome to the stage our 2024 Executive Luncheon co-chairs and your hosts today, Dr. Scott Rissmiller and Todd Wells.
All right, well, good morning. All right, that wasn't good. All right, let's try this again. Good morning.
Good morning.
All right, Brenda, I'm gonna go off script for just a minute and just go, wow, this is absolutely incredible. I've been part of this organization, which I so dearly love, for several years now, and have done a couple of these luncheons, and I have never seen anything like this. This is incredible. So give your all, thank you for coming. All right, back on script. So want to welcome everybody to the 2024 NC MedAssist Executive Luncheon. To those with us virtually, thank you for joining in. Todd and I are honored to be here with you today as your co-chairs. We have a sold-out crowd today, as you can tell. Over 800 people here in Charlotte, another couple hundred online. We only had 700 and some programs, so you outstripped our supply of programs. So good job there, and sorry if you didn't get one. Todd?
I'm going to go off script and say, first and foremost, you're dealing with a couple of amateur MCs here. So please bear with us as we work through the event, but thank you so much for being here. We hope to inspire you, educate you, and empower you to join the great work of this wonderful organization. If you're joining us online, please let us know in the chat where you're from. We'd like to have participation from all 100 counties of North Carolina today.
So our theme this year is celebrating faces of hope. And you all are those faces of hope. Each one of you all for your support of NC MedAssist, whether you're a board member, a donor, an executive host, a volunteer, or a partner in hope, or just a guest, we want to say welcome and thank you.
And thank you to those of you joining us for the first time today. I know I spoke with a few of you already that this is the first time joining this event to hear the great work of this organization. I'll share my story. So I remember my first Executive Luncheon event. We were down at the old location over in Charlotte. Obviously, this is a lot better. What do you think, right? I was sitting in the audience just like many of you. In fact, I was with my Cencora colleagues, so shout out to the Cencora team here today. Thank you for being here. I remember how much I enjoyed the networking, the professional development, and of course, hearing so much about the great MedAssist organization. I chose to make a modest contribution at the event that day. I later learned about volunteering opportunities at the warehouse, and I chose to do that. Over time, I was asked to become a board member, and then, believe it or not, here I am standing in front of you today as the co-chair of the largest event in the MedAssist history. How about that? So for those of you that is your first time, MedAssist is the only statewide free pharmacy for the uninsured and low-income residents of North Carolina, headquartered right here in Charlotte.
So how many have been able to visit the office or get a tour of the facility? Raise your hands if you have. Oh, wow, that's actually way more than I thought. If you haven't, I would strongly encourage you to do so after the event. And for those who are joining us virtually, the staff can set up a virtual tour. It is worth seeing. The robot in the pharmacy is pretty amazing, and the efficiency of how they run the OTC warehouse is truly something to behold.
So some of my favorite days are spent at the office. It's really amazing to see the work that the team does each and every day to bring this mission to life. I'd like to take a minute to ask the MedAssist team who is here today to stand and be recognized, please. If you wouldn't mind, thank you. Your work is incredible. Thank you. And we've got to make another recognition. Miss Robbie, if you would please remain standing. I think I saw her somewhere. So Robbie Jarrett, would give her some special recognition. She's the Director of Patient Engagement. Where's Robbie? There she is. When I come in the office, I swing her just if you want to come visit, her door is the first one on the left. Come see her. She's reached a milestone that no one else in the organization has hit. She will have served on MedAssist for 20 years next month. So congratulations, Robbie. Dispensing hope is not just a saying or a tagline. It's the goal of MedAssist every single day. So today, we're going to do quite a bit of celebrating. And we hope to inspire you to take action in some way to engage with this important and critical work. We'd like to start by celebrating all the faces of hope right now. Please turn your attention to the screens.
NC MedAssist is on a mission to dispense hope across North Carolina. By providing access to free over-the-counter and prescription medication, we are helping to alleviate health disparities that many of our neighbors face on a daily basis. Katrina in Bertie County is a face of hope. From mobile free pharmacy program participants to guests who visit our free OTC store, our staff and volunteers are dedicated to serving with compassion, respect, and a lot of heart.
Alliance Health is a proud supporter of NC MedAssist. We partner so that none of our community members have to choose between medicine and essentials like food and shelter.
We give North Carolinians a chance to improve their health. Elsie in Wake County is a face of hope.
MedAssist is a very important partner of ours because they give so much to the community. What they do is part of our initiative in giving back to the community.
NC MedAssist is committed to advance health equity across the state. We celebrate the partners who help us provide hope.
I think we're up to 53 events actually per year, so that's either 1 or 2 every week.
NC MedAssist is committed to filling in the gap for those who are uninsured and have low income. We celebrate medication access for all.
Excited today to be here. I got a lot of COVID tests. I have different medications for eye contact. I have medications for pain.
We celebrate our volunteers, like Diane in Wilkes County.
We typically give our patients these resources, so we use NC MedAssist a lot, and it's nice to see what actually goes into this.
As we bring our mission to life, from the mountains to the coast, we celebrate all the faces of hope.
So as you can see by that video, what happens behind the scenes at NC MedAssist, made possible by you all in this room and others, it truly makes a difference in the lives of people across this great state of North Carolina. Did you know last year alone, the gifts and time donated by so many of you all in this room and others allowed NC MedAssist to dispense just over $70 million, I'll say that again, $70 million worth of life-saving medication at no charge to thousands of our neighbors across North Carolina. Absolutely incredible. Now I want to take a moment just to show some of the faces of hope that are right here in the room right now as well as online. First, we want to thank our champions and advocates at the state and local levels. Our friends at Mecklenburg County are with us here today. Thank you for being such a crucial piece of the impact that we have. And also thank you for being with us since the very beginning, over 25 years now. So that's worthy of applause. We also have some of our fantastic state representatives and local government officials here with us in Charlotte and online. Welcome and thank you. And we also have our critical agency partners with us today, so please give them a round of applause. And if you're online in the chat, please let us know. Our partners in hope are our voices, our ambassadors, and a lifeline to so many of our patients. So again, thank you. Up on the screen, you will see a list of our top program funders. Many of them are with us here today, including the Leon Levine Foundation, the Duke Endowment, and the Mercanis Foundation, or I'm sorry, Maracas Foundation. A full list of the top programs from last year are in your event program if you got here early and got one, and including our in-kind partners. I'd like to give a special shout out to Direct Relief, as they are our largest in-kind sponsors and even sponsored a table here today, so applaud for them. Now, if you've ever volunteered at an NC MedAssist warehouse or at a mobile-free pharmacy event across the state, can you please stand up? And if you're online, please give them hope in the chat. So thanks. Look around. These are the faces that are providing so much hope for our patients and our communities. And this week is actually National Volunteer Appreciation Week. Great timing around that. We could not do what we do at NC MedAssist without the volunteers that give their most precious resource, which is their time. So let's give them a round of applause as well. All right. Todd.
So the warehouse is always buzzing with volunteers. Please, I would encourage you to take the opportunity to do so if you're interested. But one in particular, our board chair, Kevin Kendrick, is usually there with his Rotary Club every Tuesday. So in addition to Kevin, I would also like to acknowledge the fellow board members that are here today. If you wouldn't mind, please stand or raise your hand in the chat and be recognized. Thank you. So this event obviously takes a village, and I'd like to recognize the Executive Luncheon Committee. If you wouldn't mind standing, please. Thank you, yep. So this group of leaders made today happen, and many of you are here today because you were invited by someone on this committee. They jumped in with us and have made this one of the largest events in the history, as we've mentioned, so thank you. We've worked for close to 6 months and ensure we achieved our sponsorship goals and fundraising goals for the event. And we've walked away or come into this room today only $100,000 away from our goal. So we have a shot at achieving our goal. I'm going to go through the list of sponsors, so just bear with me. We've had an amazing turnout from sponsors. So for those sponsors that have made today's program possible, Atrium, Cencora, Live Events Management Group, the North Carolina Healthcare Association, Compass Group, the Katie Blessing Foundation, Image Wealth, First Horizon, McGuire Woods and McGuire Woods Consulting, Charlotte Medical Professionals Magazine, EY, and of course, all of the individual table sponsors. And last but not least, to our video partner, Root Sky Productions, thank you, Everett. Please join me in recognizing our corporate sponsors. So a full list of all the supporters of the mission can be found in your event programs. We had such a large turnout today that you may not have gotten a program, but that's okay. There's QR codes on all the tables so that you can access it digitally. Speaking of supporters, many of you have already given generously, so that obviously is extremely appreciated. There will be an opportunity later in the program to have another chance to give, and it's a personal choice, but I encourage you to do so, of course. If you'd like to add your face to the many that stood as volunteers, please let us know on your commitment cards. There's lots of ways to give, right, including your time. So just doing some quick math, Scott, we're only $100,000 from our goal. It costs approximately $230 to sponsor one patient for a year. So if everybody chose to sponsor a patient, we would well exceed our goal. So I hope many of you will consider that level of giving when it comes time today.
Thanks, Todd. So the work at NC MedAssist is critical in addressing the health disparities that plague so many of North Carolinians. And I'm excited to hear Dr. Aluko's keynote, as I know we'll have some tangible ways that we can all be part of the solution. And in speaking of being part of the solution, I think there's a great transition, Todd, to our first award. So did you know that the bulk of the over-the-counter medications that comes through the doors at NC MedAssist are provided by Second Harvest Food Bank of Metrolina?
No kidding. Well, that would explain all the banana boxes in the warehouse. And if you have been to the warehouse, you'll see there's banana boxes everywhere. The OTC program actually wouldn't be around if it wasn't for the partnership with Second Harvest. Since inception of this program, more than 300,000 families and individuals all across the state have been able to supplement their medicine cabinet with items like fever reducers and vitamins. This represents more than $371 million in healthcare cost avoidance. Each week, Second Harvest Food Bank delivers critical medication under the leadership and direction of their CEO, Kay Carter, a trailblazer and model community partner, that's for sure. We are so thrilled to be able to present the Dispensing of Hope Catalyst Award to Second Harvest Food Bank of Metrolina. Thank you. And accepting this award is their Chief Program Officer, Ethan Altmeyer. I'll hold it for you if you want to talk. Thank you, Ethan.
Appreciate it. Very quickly, I'd like to say that I'm honored to accept this award on behalf of Second Harvest. We are one of the few food banks in the country that can accept over-the-counter medicine, and that is largely because of NC MedAssist. So I'd just like to thank their staff, their board, and especially all of their supporters. Thank you for this. We really, truly appreciate your partnership.
Thank you.
So now I know many of our Atrium colleagues who are here today, thanks for showing up, have volunteered in a warehouse and across the state through the Mobile Free Pharmacy Program. And thank you for all coming today. I think we have 3 tables full of my friends. So it's only fitting that Atrium serve as the proud sponsor of the Joyce Excellence in Volunteerism Award this year. And as Lois England joins us on the stage, I'd like to share a short message about Atrium Health and our community commitment.
So as a healthcare organization, we see the issues, we see the people, and we're going to put some things in place to ensure that you can live longer. And that is so beautiful.
It was such a diverse group of medical professionals and care professionals who really guided me through this. And never ever did I feel lost.
We are addressing health disparities so we can improve life expectancy, clinical outcomes, and social drivers of health.
Hello. There we go. So once again, thank you all for being here today. We are proud to sponsor this event and this award, and we thank all of you who have joined us and are sponsoring these tables and this event as well. As Dr. Rissmiller mentioned, Atrium Health is proud to be a sponsor, but not only supports this mission financially, but also by engaging our teammates in community service at the MedAssist warehouse and at the mobile free pharmacy events throughout the state. This year, Atrium Health will again partner with NC MedAssist to provide funding and volunteers for 12 mobile free pharmacies, supporting our health equity pledge that you just heard about, and by providing access for patients in need. At Atrium Health, community service is in our DNA. In fact, our teammates donated over 32,000 hours to nonprofits last year, equating to nearly $1.3 million in community benefit. Please help me thank these healthcare heroes. If you're an Atrium Health employee, please stand and be recognized. Thank you. And Scott mentioned the 3 tables here, but we had more people that wanted to participate than we could house at these tables, so they're actually spread throughout the room. Thank you all for being here. Before we introduce this year's Joyce Excellence in Volunteerism Award recipient, we have a special tribute to the award's namesake, Dr. Donald and Mrs. Carmel Joyce. Today, we honor their work and their memory. Thank you.
My history with NC MedAssist began in 2007. I was hired by the board to be the executive director for MedAssist of Mecklenburg at that time. And Dr. Joyce was on the board and immediately welcomed me and made me feel like I was his family from the very beginning. And then when I met Carmel, they were just this wonderful, loving couple that had hands in numerous organizations across Mecklenburg and Gaston County.
One of the things I admired most about my parents was their willingness to play a small part in a big mission. You know, my parents were very much willing to champion a good cause, but they were also willing to do the little things.
Dr. Joyce's personality was one of servanthood. He wanted to know what he could do to help, from, ushering people in to serving drinks. He was the greatest bartender we had at some of our festivities.
If you knew them, you knew that they were very different people. And my dad was very much the logical and practical one, and my mother was very much the passionate and adventurous one. And so they made quite a team, and they were never happier than when they were doing for others. And MedAssist was really one of those organizations that they were just so proud to be a part of.
I loved watching Dr. Joyce and Carmel. They loved each other. And I'll never forget one of our galas. Carmel and he were dancing, and Carmel always outlasted Dr. Joyce on the dance floor. And she seemed to always find willing participants that would keep up with her. So he would just let her go. And it was a joy to watch, and something that I think we all should aspire to in our relationships. When I think about their love for one another, I saw it demonstrated so many times. The only reason he stopped volunteering with us was because Carmel needed him to be with her at home. And there were times when he brought Carmel with him, and she and I would sit and chat. And then there were times when she couldn't sit with us. She was uncomfortable, and so he would take her home. But just being willing to include her in the things he was doing that day showed us how much he loved her and how much she loved him. I talked to Don after Carmel passed 5 years ago now, and he started to come back and do what he could for the organization, but his own health was declining. He always came to a fundraising or a talk event. Anytime we had beer, he came, and he was a joy to be around. And I'm so happy to honor their memory in this way.
We're so grateful that MedAssist has named the Volunteerism Award after our parents. We were really fortunate growing up to have a mom and a dad who embraced this simple idea that if you could help other people, then you should do it. There was nothing complicated about it, nothing that you needed to overthink. If you're able to help others in need, then that's what you should do. The work of MedAssist has always meant so much to both of them, and I think that if they knew that this award might motivate others to become volunteers or to really show appreciation for the hard work of volunteers who put so much time and effort into the wonderful work of MedAssist, they would be really, really proud of that.
The Joyces embodied the aspects of character, commitment, and community. Commitment to NC MedAssist, service to the community, because no one agency can do it all, and great character, loving each other, loving the community, and bringing others in to NC MedAssist and the work that we're doing. So today we honor and remember Carmel and Dr. Joyce for their service to NC MedAssist and the community.
Please welcome to the stage NC MedAssist CEO Brenda Vass and Board Chairman Kevin Kendrick.
Good morning. Dr. Joyce and Carmel they were like the cool uncle and aunt to me. Really enjoyed seeing them, hanging out with them. And Carmel was extremely feisty. I loved it. I loved every minute of it. And as my pseudo uncle and aunt, that makes their daughter, Cynthia, who's here today, my cousin. Cynthia, would you join me on stage, please? She had no idea. They will forever be a part of our family. And we did what families do. We capture memories in a photo. And we've compiled several memories with Carmel and Dr. Joyce, and we'd like to present that to you today.
That is so beautiful. Thank you so much. This is surreal. I would like to say that my mother would not have approved of what I was wearing had we known I was coming up on the stage. So Mom, I apologize, but that was such a beautiful tribute. And it's amazing to see, because I can remember when MedAssist was a much smaller organization, and this is just a beautiful thing to see. and it's grown with Charlotte, and this just feels beautiful to me. So thank you. And let's share that with, oh, I'm sorry. Oh, okay. Sorry. Seriously, I have a tear on my eye. Thank you. You guys are so
So at this time, it is my privilege to announce the recipient of the 2024 Joyce Excellence in Volunteerism Award. If you haven't guessed already, volunteers are a pretty big deal to us, okay? The gift of time is priceless, and it's the one thing you can't get back, right? So that's why it's such a big deal to us. I am so proud to announce that Dr. Dramona Page is the recipient for this year's award. So let me tell you a little bit about our friend, Dr. Dramona Page. She is a pharmacist by trade, and she's volunteered with us since 2019 after Googling what is the best, most awesomest organization to volunteer with, and we popped up, okay? But she was particularly interested in using her expertise to help others. She gravitated toward our mobile events. She was seen at over a dozen events, and at one point we looked at each other, the staff, and said, "Who is that? Why is she everywhere?" So it didn't matter what city we were in, sometimes she would come. And we finally started to get to know who she was and why she was. It was very clear to us that she cared more than just putting in volunteer hours. She would take time to use her expertise to consult with individuals before they had to decide what OTC medicine they would select. Eventually, she joined our pharmacy committee, and she challenges us on every meeting. We love it because we know that where her heart is. It's coming from a good place. How do we provide mission excellence? Center it around the patient. She's all about the patient. Dramona serves also as a volunteer in our warehouse, and she can be seen all across the state serving at some of our health fairs that we can't get to. She's a wonderful ambassador to the organization. She's driven more than 200 miles one way to volunteer quite a few times. So, I am so proud to introduce our recipient this year, Dr. Dramona Page.
First of all, no one can tell me that that's not an internationally acclaimed humanitarian award. I will have it bronzed later. Very, very thankful. I had to write something down so that I could speak clearly to you all because this is a little emotional for me. I'm honored to be recognized for something that has been so fulfilling to me, and I'm grateful to have my son, Dre Monte, and my parents, Mr. Thomas and Dr. Monica Coles, here with me today to celebrate with me and to support me. Briefly, I just want to share something with you all about hope, and to do that, I need to talk with you about a family member who is not here with me today. So my angel, my face of hope, is my daughter, Dejana. Her name means God's gift of hope, and Dejana transitioned or passed away unexpectedly in 2008 at the age of 9 months and 4 days. So at that time, I dived into life, wanted to be productive. I got 3 degrees, but when life quieted down, I realized I had been distracting myself quite a bit, and that's when I found NC MedAssist. So I realized I had lost my hope, and partnering with NC MedAssist to serve others helped me to find that hope again. So I'm happy to do that, to bring hope to our patients, and to also inspire our other healthcare professionals, executives, volunteers. I've met some incredible individuals as patients, as volunteers, and I'm so thankful and so grateful to serve alongside each of you today, and to be here with you all today. Thank you so much for your time.
All right, OMG, what an inspiration, holy cow. So before we move to our keynote address, Scott and I would like to make some additional thank yous, especially to have been instrumental in this year's event. This year's executive hosts, or table hosts, if you will. We have over 90 executive hosts this year, both in person and online. Our executive hosts represent our statewide footprint and have been our ambassadors for the last few months, inviting others to participate in today's event. So please join me in recognizing our table hosts and executive hosts today. I think I'm supposed to keep talking. Here we go. As a token of our appreciation, please take the beautiful centerpieces with you. So this is for the executive host, or if you don't want it, you can please give it to somebody at your table. You'll notice we've included a dogwood this year because that's the state flower of North Carolina. But thank you again for inviting guests to attend, and we hope they have inspired to give today as well. So on that note, I want to thank some of those individuals who have already given funds to support our patients. Patients like Lola, who you will meet shortly. We'd like to acknowledge some of our top individual sponsors who are members of our giving societies starting at the $1,000 giving level. A full list of these members are listed in your event program. And if you wouldn't mind, if you're a member of these great groups, please stand to be recognized.
So as advocates, as champions and catalysts for hope, we have made the decision to make NC MedAssist one of our top philanthropic efforts, and I, for one, am very proud to be here with you all today, so many of you all who are committed to it. We hope that you consider joining one of these societies through giving at a level that feels most meaningful and impactful to you. We're close to the goal. You saw the math earlier. I'm glad you did the math. I'm not very good at math. But we are close, so please consider giving. You've heard us talk about impact that we're making at NC MedAssist. You've heard us talk about being part of the solution. Hopefully you're inspired and humbled by this work. I know I am, and you're ready to jump in and do what you can to move our mission forward. So now is time for us to learn together and empower each other. And here to help us do that is our keynote speaker, Dr. Yele Aluko, Chief Medical Officer for EY Americas. I've known Yele for many, many years. He advises health system C-suites and senior executives on strategy, business operations, provides insight on megatrends confronting healthcare industry. Not only did he obtain his MBA at Wake Forest University, which is part of Advocate Health, Atrium Health, we're very excited about the medical school in that. He also practiced cardiovascular medicine for 25 years. He is an advisory board he is an advisory board member, as well as a member of the Governance Council of the International Well-Building Institute. Healthcare is his passion. I have known him for a long time, and that is an understatement. It is his calling, and we are honored to have him with us here today as our keynote speaker. So please help me in welcoming Dr. Yele Aluko to the stage. Yes, sir.
Good afternoon. Good afternoon. I want to thank you, first of all, NC MedAssist, for this invitation to talk to you today. And I want to also emphasize how thrilled, how honored I am to be asked to speak to you this afternoon. I'd like to share some thoughts on the work and the value proposition that NC MedAssist brings to North Carolina. You've heard snippets of that already. I also want to frame a rationale for those of you that are new to the organization as to why you might consider supporting this fine organization and its people and its purpose. And for those of you who are existing supporters, we thank you. Also hope to be able to articulate a value proposition as to why you can amplify your current support going forward. Now, it's important for us all to understand that each day, each and every day, NC MedAssist brings incredible value to the state of North Carolina in its work to reduce health disparities. It does so in many ways, but fundamentally by providing access to medications, prescription, and over-the-counter for uninsured North Carolinians and underinsured North Carolinians. Now, to put this into real-life context, consider 2 infant girls born 2 days ago in one of our local hospitals. These children were delivered by the same physician team, and they were discharged today after a 2-day hospitalization. They were discharged healthy, and that is where their similarities ended. And this is because the parents of one child took a right turn out of the hospital to suburban Charlotte, and the parents of the other child took a left turn to inner city urban Charlotte. The child that was blessed to be in a suburban situation, had a nurturing home environment, had access to health care coverage, had access to mentorship in regards to health literacy, was more predictable to have a good health care outcome over a life trajectory. On the other hand, the child that went to the inner city had a less predictable trajectory in that consistent access to healthcare coverage was unpredictable and uncertain. Access to vaccinations, fundamental vaccinations for a child, was unpredictable. And over the span of 50 years, the level of health risk, if you were to follow these 2 children to adulthood, would be very different. So what I'm talking today about in regards to NC MedAssist is access to medications as a political and social determinant of health. What I've just described with 2 children is evidence of health inequity because of health disparities. Health inequity, and in other words, the absence of health equity. So what exactly do we mean when we say health equity? Health equity is an aspirational context. It doesn't really exist, and it never has existed. We seek to get to the true north, which is health equity, and it's done by one methodology, and that is by eliminating health disparities. Now, health equity is achieved when every person has the opportunity to attain their full health potential, and nobody is disadvantaged from achieving that goal because of their social position or other socially determined circumstances. Now, risk for health inequity is not a random occurrence. It is not driven by race. It's not driven by genetics. But it's certainly not random. It is driven by a very complex interaction of what we call the political determinants of health. And these include federal and state laws, judicial orders, executive orders that determine and control the distribution of power, resources, and relationships across American society and organizations, our communities, our cities, and our society at large. Now, these political determinants of health perpetuate structural inequities that are ingrained in American society. And I refer to things such as systemic biases and inequities, which can manifest as overtly as racism, systemically, or more insidiously as implicit bias, sexism, classism, and more. And this is seen across multiple dimensions of American life. So the political determinants of health create the social drivers that affect all other dynamics of health. For example, the decision of a state government to accept or not to accept the Affordable Care Act, also known as Obamacare, is an example of a political determinant of health. Lack of embracement of Obamacare is an intentional decision made by a state government to deny additional Medicaid coverage to newly eligible citizens, and by so doing, implicitly deny such residents access to prescription medications, and therefore denies them access to quality health care. Now, another example is the overturning of Roe v. Wade by the Supreme Court, which you all know has led to the recent Arizona Supreme Court decision, which has put Arizona physicians and the entire state on notice that all abortions are illegal in the state of Arizona, except those necessary to save a woman's life. So, in effect, this is reducing access to reproductive health care for women. These are examples of political determinants of health. Now, Medicaid expansion was signed into North Carolina law in March 2023. It went to effect 4 months ago, December 2023, 13 years after it was enacted by federal law. Now, the state of North Carolina should be applauded for finally accepting Medicaid expansion, because by so doing, Medicaid expansion will provide health insurance coverage for thousands of the previously 1 million uninsured North Carolinians. Now, we've talked about the political determinants of health being interwoven with structural inequities. It's important to understand that this interaction drives either adverse or favorable social determinants of health in communities, and such as people's access or lack thereof to healthy food, to employment, to safe housing, access to health insurance, and by extension, access to health care facilities and health care itself. Those persons that benefit from favorable social determinants of health, as the young child who made a right turn on leaving the hospital, those persons that are exposed to favorable social determinants of health are better positioned for healthier lives and outcomes. Those exposed to adverse social determinants of health are vulnerable to increased health risk, health disparities, and comparatively worse outcomes. And a clear example is life expectancy in America. The average life expectancy of Caucasians is 77 years of age as of 2022, and it's 72 for African Americans. So that is an example of a health disparity. So what does this all have to do with North Carolina MedAssist? So let's take a look at this slide for a moment. We know the biopharmaceutical industry, the Pfizers, the Modernas, Johnson & Johnson is in the house there, BMS, and others. They manufacture drugs to prevent, to treat, and to cure disease. Healthcare providers prescribe the drugs. Health insurance companies pay for the drugs, be it through government or commercial health plan coverage. And we, the patients, the consumers, we get the drugs from retail pharmacies. Now, there's a big problem if people get sick, need prescription medications, but don't have health insurance coverage to pay for them, particularly if they have chronic illness that requires continuous medical therapy. Think diabetes, think about asthma, think about hypertension, think about congestive heart failure, and there's a plethora of clinical conditions that require consistent and uninterrupted treatment. Here is where the value of North Carolina MedAssist comes to play. Let me also mention that those that are unable to get continuous medications, they're unable to work. They're unable to take care of themselves. They're less likely to take care of their parental responsibilities if they are parents. And they become fundamentally dysfunctional in society. So North Carolina MedAssist, since its 1997 inception, has sought to bridge this gap to connect all eligible North Carolina residents to affordable and accessible medications. You've heard this. But I want to reiterate its mission and its purpose. Its purpose is to dispense opportunities through improved health. So it goes way beyond just getting medications. It's giving medications so people can get healthy, so they can be resilient and productive. Dispense opportunities through improved health to ensure that no eligible person in North Carolina must choose between purchasing food or purchasing medications. And the end goal downstream is to improve health outcomes and reduce healthcare costs by addressing barriers to medication adherence and to close the gaps in health disparities and to move the needle towards health equity. It has an extensive formulary of prescription medications to treat chronic conditions. It has an extensive formulary of over-the-counter medications that are available through the North Carolina MedAssist stores and their mobile free pharmacies throughout the state. NC MedAssist's footprint spans across North Carolina, with Partners in Hope and mobile free pharmacies touching every region of the state. So take a look at this slide. Look at the footprint by county. The green dots reflect NCMA's free pharmacy locations. The yellow dots reflect additional locations that are facilitated by NC MedAssist Partners in Hope relationships. On its own, NCMA reaches 32 of North Carolina's 100 counties through its mobile free pharmacies. However, through its approximately 50 organizational partner members of the Partners in Hope relationship, in combination, in synergy, it touches more than 60 North Carolina countries, which represents more than 60% of our state footprint. Now, these partners in hope must be applauded. They come from several North Carolina health systems, our community health centers and clinics, and our federally qualified health centers, all the way from Anson County to Ashe County, from Wilkes County to Wake County, and everywhere in between. The organization's impact on the North Carolina healthcare ecosystem is massive. And you've heard these today, but I want to reiterate them because I think it's important to do so. The NC MedAssist ongoing operations are crucial for the well-being of all its stakeholders. So pay attention again to the value proposition delivered by NCMA in 2023. Dispensed over 70 million worth of medications. We filled approximately 185,000 90-day prescriptions. Served more than 57,000 individuals and families through the free over-the-counter medicine program. And including its mail order program, it served approximately 75,000 total individuals and families with prescription medications. And I want you to remember the 75,000 number of people served. And it achieved $61 million in healthcare cost avoidance and $131 million in total economic benefits. But it does much more. It provides a conduit for upward employment mobility for those within the transitional jobs programs, providing opportunity to work in MedAssist stores, warehouses, and others to learn those jobs. About 2 or 3 months ago, when I was asked to do this talk, I went to the warehouse and I met the admirable, committed staff that work in the trenches behind the scenes, counting medications, dispensing medications, allocating different types of medication, different locations. It was very impressive. NC MedAssist provides a means for its donors to meet their corporate social responsibility obligations. It is an enabler of health equity. It is a facilitator on the journey from health disparity, gap closure towards health equity by addressing social determinants of health through their programs and their initiatives. By providing accessible, free medications, NC MedAssist participants will be more likely to adhere to medication regimens, thus reducing the incidence of medication interruption and noncompliance. So, is Medicaid expansion good or bad for North Carolina MedAssist? That was the first question I asked myself when I began to dig into the business models of NC MedAssist, and after visiting NC MedAssist leadership and their workers in their warehouse. Let's probe this for a minute. What impact does Medicare expansion in North Carolina have on the business model of MedAssist? Now, some might say that Medicaid expansion is a threat to the viability of North Carolina MedAssist. So as of April 1st this year, North Carolina enrollment under Medicaid expansion has surpassed 400,000 in the first 4 months of its launch. And officials project that enrollment will reach 600,000 over the next couple of years. Now, many enrollees are either young adults or people that live in rural communities. Those that have benefited from this expansion have reached more than 700,000 prescriptions and generated more than $11 million in dental service claims to date. So, important to know the following, that as Medicaid expansion continues, there will be a shift to fewer numbers of uninsured North Carolinians, to greater numbers of underinsured consumers in North Carolina. So remember, 2023, we reached 75,000 people. But also note that there are 400,000 potential people to be reached. So the future of NC MedAssist, let's talk about what that might be. The organization will continue delivering meaningful impact to North Carolinians in need, but it can double down on its core mission while innovating on its business model. It has an opportunity to expand its reach to amplify its position as a credible, not-profit partner in multiple ways, by enabling execution of corporate social responsibility obligations with partner organizations, and by seeking to meaningfully expand its philanthropic and foundation funding streams to develop an expanded portfolio of corporate partners and donors. Now, Medicaid expansion in of itself is a triumph for care access in North Carolina, but also an opportunity for NC MedAssist to evolve to meet the changing market dynamics. How so? As Medicaid expansion shifts the landscape of uninsured North Carolina residents, it is a win-win for both our residents and for NC MedAssist. So although Medicaid expansion will decrease the number of the uninsured residents by 600,000, like I said, 400,000 residents remain uninsured. Again, I will remind you again, 2023, NC MedAssist reached about 75,000 members. So there is a large upside opportunity. And additionally, a large number of underinsured North Carolina residents, different from uninsured, can benefit from NCMA's expertise and services. MedAssist is uniquely positioned to serve those ineligible for traditional Medicaid coverage or those who are at risk of being underinsured through their existing relationships. So why should you support NC MedAssist? Well, for starters, I think it's difficult for anybody here not to be aligned with its mission, its purpose, and to be proud of its track record. Individuals and organizations within and beyond the health industry value chain have a role to play. All organizations in North Carolina are well positioned to support access to free medications through NC MedAssist. How so? So by addressing affordability challenges for vulnerable patients and demographics, mitigates access barriers to life-sustaining medications. Your dollars can help NC MedAssist amplify their current work. By addressing other social determinants of health, providing health education, improving health literacy, address transportation access barriers, offer job training and employment opportunities to bolster long-term financial security. And implicitly, by partnering and supporting NC MedAssist, you are amplifying their competencies to strengthen the healthcare delivery systems in North Carolina, enabling health equity progress for North Carolinians, investing in the future of healthcare, where upstream social determinants of health are addressed to create equitable outcomes. And you are investing in long-term value for North Carolina's business and our society at large. Do this by minimizing workforce impacts due to medication access and adherence barriers, accelerating state and local advocacy and ambassadorship to impact the political determinants of health. If you partner with NC MedAssist, you're partnering with an organization that is an exponential driver of value across North Carolina's health consumers, our health systems, and our communities. However, how does it reach this untapped opportunity of 400,000 uninsured users that remain after Medicaid expansion, and how does it reach the additional several underinsured users? NC MedAssist has an opportunity to pivot its strategy, to execute intentionally, quickly, and deliberately. Now, it needs your help to do that. It needs your help for it to be able to double down in this very complex health industry, changing and dynamic environment. It needs your help to expand its operations. It needs your help to innovate its business models, to stretch its reach, to gain more traction into those dual population opportunities. So here's my call to action to each and every one of us here today. I'd like for you today to consider becoming a force multiplier of the mission of NC MedAssist. I ask for you today to consider becoming a scalable economic and societal impact multiplier by partnering with NC MedAssist so that they can scale more effectively across the region. They're doing admirable work, but I think that they are scraping the surface of their opportunity. So how do you get involved? There's several ways to get involved. As an individual, or as a corporation, as an advocacy group, community organization. Volunteer your time. You can bring your time and expertise to NC MedAssist and donate it. Individual and group volunteer opportunities are available through sign up on NC MedAssist's website. And I mentioned volunteer activities that I witnessed myself: sorting medications, performing office tasks, assisting the mobile free pharmacy program. Secondly, you can donate dollars, donate money to contribute to MedAssist's operations. You can do one-time or recurring donations made through the organization's website or by email. Diverse donation types are accepted, including those made through assets, gift annuities, wills, and retirement plan benefits. You can become a partner in hope. And by so doing, your organizational partnership, you support NC MedAssist's mission and ongoing operations by becoming a valued corporate partner and by scaling the operations to drive incremental, exponential value to the state of North Carolina. You partner with other organizations that address root causes of health disparities. And finally, you can be an intentional advocate. You can advocate with intention. You can advocate for systems change to address the political determinants of health. Seek opportunities to re-engineer health industry businesses and care models toward achieving health equity, delivery, and accountability. Utilize your public platforms and your private platforms to elevate awareness and to catalyze action with ecosystem stakeholders. Your support will sustain NC MedAssist's critical work to improve medication access throughout North Carolina, but by so doing, improving the health care of North Carolinians and improving the health of North Carolinians. I'll close with a few quotes to channel your thinking. So a wise North Carolinian woman once said, "Do the best you can until you know better. And when you know better, do better." And you all know that it was Maya Angelou that spoke these words. Based on our conversation here today, I hope that you better understand who NCMA is. I hope you better understand its value proposition for individuals, for our health systems, for the state of North Carolina. And if you know better, I hope you will partner with it so that you can do better to help it do better. A wise South African archbishop once said, There comes a point when we need to stop just pulling people out of the river downstream. We need to go upstream to find out why in the heck are they falling in. Now, so he was referring to upstream political drivers of societal equity in South Africa and the downstream impact of adverse social determinants of equity. This analogy fits perfectly into what we've talked about today regarding the upstream political determinants and the social determinants of health as drivers of health disparities. That wise man was Archbishop Desmond Tutu. And finally, a most revered African-American civil rights leader who, when he and his partners and followers, having faced multiple water hosing attacks in his civil rights struggle, he and they'd come to realize that in the fight for social justice and racial equity in the United States of America, they'd come to understand that there was a new kind of physics that somehow didn't relate to the trans physics that they learned in school. He said that the new kind of physics that they were observing did not align with the trans physics that they knew. And that was the fact that there was a certain kind of fire that no water hosing, no water could put out, which violated the fundamental rules of physics. So my take on this is the implication that in our contemporary times, in pursuit of health equity in North Carolina and in these United States of America today, a collective mass of societal will must create a societal fire towards achieving health industry transformation that will drive health equity. A societal fire that no water hosing, no anti-woke movement can put out. And you all know that those were the words of Martin Luther King that I quoted. I thank you for your attention today. Thank you very much for the invitation. I'd like you to please keep your attention focused on the screen for a very special, personal message. Thank you again.
My name is Lola. I was child number 5 of 6. I was quite popular. In junior high school, I was always in leadership. When I got to high school, I ran for 10th grade president, and I won. A little bit after I turned 18 and graduated, I ended up walking down the street and met a young guy. And that is when my life changed in a dark way. For 15 years, my life was a living hell. I was in rehab for 2.5 years. Being in rehab, I went to the facility. I stayed there for a good 4 to 5 months. I left there and went to a sober living home. For the first 60 days, I had to go to meetings every day. I did regain employment, so I was working, and in the evenings, I would go to these meetings. That is what saved me. I did get my insurance license. Both insurance and mortgage allowed me to interact with people, help people, and that's what I enjoy doing. I said, okay, I'm gonna go home. I'm gonna help everybody take care of her, give the ones in LA a break. They literally pronounced her dead at the house. I was in a way that I've never experienced before. I was devastated and I was angry. It was a real struggle for Daddy, so he, my sister, and my brother Philip and his family all moved to Charlotte. So I became mommy and didn't understand that I was putting myself and my health in jeopardy. I was experiencing headaches and I ended up having a stroke. Within less than, I would say, 30 days, I had another stroke. I drove myself to the emergency room, and that's when they said, we are admitting you for a spleen stroke. So after a day or so went by and the doctor came back, he said, have you been taking your medication? I said, no. I didn't have insurance and I've been stroke free for 7 years, so I thought everything was wonderful. The place is called NCMA. I didn't know places existed that someone like me that is in the professional world could get free medicine, because even though I wasn't working, I still didn't think I was worthy. I realized I have to take medicine. I wanted to stay alive. NCMA took me and they saved my life. I still feel I'm responsible for my family. When I look at all the problems and illnesses, I share everything that I can possibly share with my family because it's so important. Mommy and Daddy didn't, and if they would have, I truly believe that maybe some of my siblings may not be dead. I don't know. I owe my life to NCMA. You all have saved me. You all have kept me alive. People need to know that there's hope out there.
Wow. I don't know about y'all, but that is truly a moving, compelling story about a fellow human being who has worked through so many difficult issues. That's why we're here, folks. For Lola and the countless others out there that need critical programs like MedAssist. For the thousands that count on MedAssist, and the thousands that need to know that they can count on MedAssist. During this time, we'd like you to invest in this critical work that so many staff people and volunteers are doing. I want to give a shout out right now to Lola. She is with us here. Lola, would you please just stand up and be recognized? Now, we've listed the names of those who have already given this year on the screen and in your programs. Thank you. If you have not made a gift to this important work, now is your opportunity to do so. Lola, you shared with us that you're focused on improving your health because you want to get to an important age that no woman in your family has ever made it to. What age is that? 60, 69? 69 years old. You heard Todd say earlier today, if everyone in this room sponsored a patient at $230, we would surpass our goal today. Well, how about a gift of, let's say, $70 in honor of Lola? Imagine the impact of that. Will you please consider giving a meaningful gift today? $70 in honor of Lola. I've got another message to share, and that is Scott Rissmiller, who you've already met, one of our co-hosts here today. Scott and Sonia are generously going to match the first $20,000 we give today. And so I'd like to give a hand to Scott. I'd like to give a hand to Scott for doing that. Scott, thank you so much. To our friends online, you'll find the link to give in that chat box, or you can scan the QR code on your screen. Did you know that for every $230 you give, patients like Lola will receive 1 year of medications totally free of charge? For many of us, we've never had to make a choice between filling a prescription or feeding our families. These prescriptions are helping provide people like Lola with a better quality of life. And for those with chronic illnesses like diabetes, hypertension, cardiovascular diseases, which run in my family, and even asthma. For the past few years, to provide inhalers to those that need it has increased MedAssist expenses by more than 40%. And thanks to Carolina Complete Health, we've got a special incentive for you to support at least one patient for $230. You're going to be entered to win 2 tickets in the suite of an upcoming Charlotte FC club. Food and drinks and a parking pass are included, and so if you give at least $230, you're going to automatically be entered to win. Again, you can use the cards on your table, or for our friends online, please use the QR code on the screens or link in the chat. Thank you. Lola, I just want to acknowledge you again. Thank you for being here and for being brave enough to share your story with us. And thank you also for being an executive host. We are so glad you could bring your fan club with you. And to all you in the room and online, I hope you are inspired by this work. I know I am. I'm going to go off script just a little bit here, because one thing that we haven't mentioned yet, and that's vitally important to me and all of those who volunteer at MedAssist, is their transitional jobs program. So MedAssist is not only helping people to get healthy, they're helping our employees, our staff people, to get healthy and giving them some credibility to be able to rebuild their lives. I am so impressed with their transitional jobs program. So I just want to say thank you. Please give your donation card to your executive host once you've completed your gift, and we'll have the staff pick those up. Thank you for I can't talk. Thank you for providing hope for so many of our neighbors across the state. And thank you to our wonderful host and co-chairs, Scott Rissmiller and Todd Wells. Let's give them a round of applause as they make their way back to stage. Scott, Todd.
All right. Well, thank you, Kevin. Thank you for leading us through that moment and for leading the ask. And I would ask, please take them up on that ask to give this incredible organization. And Kevin, just want to say thank you, too, for leading this board the past year. Your leadership has been phenomenal, so round of applause. So this year at NC MedAssist is a crucial one. It's the first year of our 3-year strategic plan. And on December 1st of this past year, as you heard, North Carolina finally became the 40th state to expand Medicaid, which is a really good thing. So round of applause around that. But as you heard from our great speaker today, that brings different challenges and still leaves people behind. So the work of this organization is as important, if not more than ever. So do I have to say as a former board member? I guess today is my last day as a board member. Yeah. Well, I'm going to say as a board member. I'm not ready to, I got a couple more minutes.
Always have a spot.
Yeah. I will tell you that we've been at MedAssist, have been preparing for Medicaid expansion for several months, ensuring that the period as people are looking of how to get coverage and everything else under the expansion of Medicaid, that we are there to fill the gaps and make sure people have the medications they need, and also to serve those that are underserved and uninsured. And as we round out year one of our strategic plan, we're excited about where this organization is headed. As you heard, the strategy will morph and continue to change, but I have no doubt that the impact that it's going to have on a community will only continue to grow. So I am proud to support Kevin and the entire board as they continue to ensure the impact of this organization. And I'm proud to have co-chaired this year's luncheon with our incoming MedAssist board chair, Todd. So thank you for taking on that. And with that, will you close us out?
Be honored. Thank you, Dr. Rissmiller. All right, we're going to end on time. So I echo Dr. Rissmiller's comments. We are in a very critical and exciting time as an organization. Definitely have some big shoes to fill. Kevin, I couldn't be more thankful to have a friend and mentor and leader such as yourself to follow. So thank you again for all your leadership. When NC expanded Medicaid, we were absolutely thrilled, as we've all heard. We're champions for healthcare access for all. We also knew that close to 500,000 individuals would still not qualify and may fall through the cracks. Our goal is the same as it's always been, to provide hope to whoever we can. So as we round out our year, one of our strategic plan and look ahead, our priority is to continue to fill the gaps and ramp up the outreach to meet people where they are. So one last time, I'd like to recognize the NC MedAssist team. I know we did it earlier, but this time I'd like you to join me on stage. This is a team effort, so for those of you that are here, please join. This is the team that really makes it happen, and I honestly could not let this day go by without at least recognizing the hard work and amazing team that we have within the MedAssist organization. Thank you for coming up. Yes, while they're coming up, please, thank you. So I know we're just about out of time. One quick reminder, if you are using the envelopes, please give them to your table hosts on your way out. We'll collect them all together. I can get out of the way, take a picture.
Need to get up.
Round and third and heading home here. So they are a small but mighty. Only 43 on staff to do all the work we've celebrated here today. And this is why volunteers are so important and so vital to this mission. So today, I hope something resonated with you and that you're ready to join us. I'd like to thank Dr. Yelialuko. Amazing speech today. We've learned a lot. Can't thank you enough for your time. We look forward to hearing more from you in the future. To the volunteers, we look forward to seeing you soon at one of the statewide events or on site. And just wanted to say thank you one last time. So thank you very much for being here today. We hope to see you soon. Take care.